If you're having surgery for a meniscus tear and the surgeon talks about trimming out the tear, what does that mean for you? I'm Dr. David Geyer, orthopedic surgeon and sports medicine specialist. I provide education and insight on sports and exercise injuries, injury treatments, and injury prevention for athletes and active people so that you can stay healthy and perform your best. We talked about in the video last week about meniscus tear. We talked about how that's that C-shaped shock absorber between the femur and the tibia. You have one on each side of each knee, and we talked about how common it is to tear those. Now, what we started to talk about last week, and if you missed those, by the way, in this whole series, if you're watching on Facebook, you might have to go through my timeline. You'll have to like my page to see that. But better yet, go to my YouTube channel, subscribe to that. You'll see a section called Injuries and Surgeries, and you'll see these videos. Or go to my website, drdavidgeyer.com, and you'll see them there. But we talked about, at the very end of that video on meniscus tears, how non-surgical treatments very often don't help that much because meniscus tears don't necessarily heal on their own. We're not talking so much about the degenerative meniscus tears that come on in older people, but especially if you're like 50 and under, meniscus tears can be really problematic. And because they have a limited blood supply, they don't usually heal on their own. And there's two main treatments when we talk about surgery for a meniscus tear. One is what we call partial meniscectomy. It's trimming out the torn part. I'm going to talk about that here in a second. The next one is meniscus repair, sewing it back together, and I'll talk about that same location, YouTube, Facebook, and on my website next week. So when we're talking about a partial meniscectomy, that's using, it's all through the scope. You use these little tiny scissors and shaver to trim out the part of the meniscus that's torn. That does very well at relieving pain from the meniscus, because now you don't have that flap of meniscus tissue catching between the bones. So when you go to twist, change direction, squat down, you don't have anything catching between the bones, and you do really well. You're not taking out the entire meniscus. We did that through those long open incisions, decades ago. We don't do that because the meniscus is a shock absorber, and so we want to take out as little as possible, basically to save as much shock absorber as we can. But you have to take out enough of the tear, basically, so there's not a little fragment of the tear still left that can propagate and cause basically a second tear. So you're sort of limited as a surgeon and as a patient in how much is going to be taken out. You don't control that, and I as a surgeon can't really control that. You take out enough to relieve the symptoms. That leads to a common concern though, if you take out a lot, am I going to lose that shock absorber, and then am I going to develop arthritis down the road? The unfortunate answer to that is yes, it's absolutely possible that you can develop arthritis down the road. It's not a guarantee by any means, but it's more likely than, say, in your opposite knee or if you had never torn a meniscus. Having said that, we don't avoid the surgery just to minimize the chance of developing arthritis, because again, very often you can't do what you want to do. Now, if it's a tear that can be sewn back together, and again, we'll talk about this next week, we try to repair the meniscus to save that meniscus shock absorber so that you have it all there and hopefully minimize the chance of developing degenerative changes, arthritis changes essentially, from playing sports and exercise over a long period of time. Now, have you suffered a meniscus tear, and did you have a partial meniscectomy, a surgery where the surgeon went in and trimmed out the tear? How did it go? Did you get better? Did it help your symptoms? Did you get back to sports or exercise? Did you develop arthritis down the road? I would love to hear your experience, and I bet people all over the world would love to hear it as well. So below this video, describe your experience, describe your injury, describe the treatments. I would love to read it, and I bet everybody would as well. If you want all of these videos in this sports and exercise injuries and surgeries series, probably the best way to get those delivered directly to you is to subscribe to my YouTube channel. I record a couple of videos every single week on sports and exercise injuries, injury treatments, and injury prevention, and they'll get delivered directly to you. Go to my YouTube channel, drdavidgeyer.com, click the subscribe button in the upper right corner of the page, and they'll get delivered directly to you. Thank you so much for watching. I hope this video on meniscus tears and partial meniscectomy surgery was helpful for you. I look forward to seeing you right here next time.